everybody, and welcome to Jarg, the podcast that brings you information about endometriosis and adenomyosis. I'm joined this evening by a good friend, Dr. Conor Kerley. Conor and I met a number of years back, and he'll fill you in on that story. So Conor, it's brilliant to have you on the podcast. Do you want to give us a little bit about yourself and, tell us how we met as well after that?
Yeah, sure. So first of all, thanks a million for having me, Kathleen. This is amazing, and congratulations. So yeah, my name's Conor Kerley. I'm a dietitian by trade and a doctor of nutrition, award-winning researcher as well here in Ireland. So that's a brief introduction to me.
And Conor, I was looking for a plant-based dietitian a number of years back when I held a conference for the EAI. And given that, endometriosis and diet is one of those things that people search for so often. And, I was like, right, we want to cover everything at the conference here. We want to make sure we've got diet, we've got mindfulness, we've got all the therapies, we've got this, factual education, pelvic physios. So when I got in contact with you first, you were like, oh yeah, I do talks all the time, no problem. And I come off the phone thinking, I'm not sure he knows what endo is. And I think that might have been the situation for you. Is that right?
Yeah, I still remember well. So yeah, you rang me, I think kind of towards the tail end of 2019 and asked me to speak about endometriosis. And as you mentioned, I was more than happy to do so. But as soon as I got off the phone, I remember Googling what is endometriosis. And, I suppose that's part of the problem, isn't it? That endometriosis is just not well enough known. And, I'm a healthcare professional, did 10 years of training, did a lot of research, worked in a lot of hospitals, a lot of research labs. And I had very, very rarely heard of endometriosis ever. And I certainly didn't know what it was. So, as I said, the first thing I did was find out what it was and then how nutrition was involved. And I suppose, the conference, I think, was a couple of weeks away at that stage. So I didn't get to look at everything, but I certainly got to find out some information and present that. But I suppose one of the big issues from that day for me personally was, attending the conference, which I'd obviously never attended before, and seeing how many people were just so severely affected that I didn't really know. So just how common endometriosis was, how severe it was, and then obviously how neglected it is. So that really sparked my interest and passion. And I think if you can remember, I stuck around for the day to kind of find out more after my own presentation, to find out more and more and talk to so many people in the room. And I guess I made it sort of my life mission from there to try and help as much as possible. And just unfortunately, a couple of months later, a little thing called COVID-19 hit the world and changed not only my plans, but the whole entire world's plans. So yeah, stifled progress there, but thankfully got back into it. So
perfect. And then we were very fortunate, I think, too, that your interest continued in that because you came to the Below the Belt screening that I had organised the Irish premiere there on the 6th of October last year. And it was fantastic to see you there and to see that spark that we'd ignited in you back in November of 2019 had kept going. And you had a very moving experience at Below the Belt, I believe.
Yeah, absolutely. And, it was so great to see such a public event happening and so well attended. But just for everybody listening at home, so Kathleen organised a screening of Below the Belt, which I'm sure many listeners will be very familiar with. So as I sat down, it was random seating in the cinema. And as I sat down, a few minutes later, somebody sat in front of me and it was my cousin. And I didn't know that my cousin had endometriosis, and my cousin didn't know that I had a personal experience or a personal interest in endometriosis. So I remember tipping on the shoulder, and she looked around like, "Conor, what are you doing here?" And I was like, "Well, what are you doing here?" And then that's when I found out. So I kind of used that as a sign that this is just so common. It affects my family as well, but so many families all over the world. And then thankfully, I think there was a gynecologist, Dr. Hugh O'Connor was on the panel, and we had a good chat afterwards, and that really just ignited that there's definitely something here. And of course, speaking to other attendees as well. So, yeah, thanks for organising, Kathleen.
Oh, look, no problem. And it's great to have people like yourself from completely outside of the community attend events like that because, I speak to loads of people about endometriosis every single day of the week. The majority of them are directly affected, some are indirectly affected as well. And some people like yourself are removed from it until you start that conversation. And then they sort of go, hang on a minute, that sounds like somebody in the family or somebody that they know. So you never really know who you're speaking to. You're never going to know who that's going to affect as well. And it is quite a positive thing. And one of the things that I like when I'm choosing speakers or choosing people to speak to is I like lived experience. And I like that a lived experience can inform our approach to things. And as a scientist and, you know, combining that with lived experience, like yourself, you can come up with some fantastic ideas. And you do have, you know, a history of a chronic illness. You have history, you know, is there, you know, anything that you've taken from that sort of informed your career choice, but also, you know, your sort of social conscience and compassion around this?
Yeah, absolutely. Yeah. So just for all your listeners, when I was 15, I was diagnosed with MS, multiple sclerosis. And I guess at the time I was quite young and interested in sports and school and whatever else. And that really shifted, I suppose, my entire attitude to life. Not to get overly deep about it, but up till then I was a typical happy-go-lucky boy. You know, I was interested in sports and you know, that was mostly it really, and girls. But then, you know, the diagnosis and the severity of my illness early on really, you know, changed my attitude to life. And that's the be all and end all. So, you know, back then, you know, I became really paralyzed on the left-hand side of my body. I lost about 90% power and function. So, you know, I couldn't walk, I couldn't tie my laces, I couldn't use a knife and fork, I couldn't do anything really. And it was a long process through different therapies, physio, OT, etc., speech and language therapy, that I gradually regained function. And then unfortunately, as I was getting back to health, I had a second relapse, this time on the right-hand side of my body. And that's when the diagnosis came, and all the scans and lumbar punctures and blood tests in between. So I guess from then I really shifted from just being interested in sports to being interested in health, mostly from a selfish personal point of view, but then trying to help others as well. And one of the areas I thought had to be really important was nutrition. And this is going back 20 years ago. I'm showing my age now. So 20 years ago, like, I mean, there was very little internet. I certainly didn't have internet at home. There was no smartphones. I still remember getting information in the library and so on. So when I went to college, Trinity College here in Ireland, one of the world-renowned institutions here, you know, I studied dietetics, human nutrition and dietetics. And from there, the point was to be able to help myself improve my own nutrition and then help others as well. So absolutely, as you said, did have a major impact on my career choice, but also just on my compassion, because, you know, I've sat in the doctor's office and felt not listened to. Maybe I was a 15-year-old kid, but I still, you know, really empathize with anybody who's not listened to by healthcare professionals. And also, I think there's a huge amount in personal experience. Sorry, sorry about that. So, you know, like how you feel and how, you know, how your body reacts to different things, and that may not be the same for person to person. And then I think one thing which I've really kind of looked at is, you know, that what's the risk benefit for doing something? Because when it comes to a surgery, a new medication, some exercise, a certain nutrition approach or whatever, like, is there a benefit and is there a risk, and how do they weigh up against each other? And if we can do that, then definitely if the benefits or potential benefits outweigh the potential risks, I think it's definitely something worth you know, discussing or worth trying. And that's whether it is surgery or medication or nutrition or exercise or stress reduction, meditation, whatever it is. What is the risk and what is the benefit?
Mm-hmm. And that's, I suppose, one way where we can all become citizen scientists as well, isn't it? You know, we can run experiments on ourselves quite ethically, quite easily.
Quite ethically, yeah. Yeah, I mean, the one caveat I would say is just, you know, like sometimes, you know, people think that if they're doing something, that it is, you know, all of a sudden, you know, people start drinking more water thinking, oh my God, I got bigger muscles or something like this. When water definitely doesn't cause your muscles to get bigger. So, you know, we do need to be a little bit cautious, but absolutely a little bit of self-experimentation. Somebody come to me in clinic a while ago, tell me they were doing a blood type diet. Where they were just told, you know, I think they were blood type A and they shouldn't eat X, Y, and Z food. So of course they cut out all sugar, all carbohydrates, all fats, and, you know, added fats and so on. And they were feeling great and losing weight. But I was saying, well, it's not got to do with the blood type. It's just because you're not eating sugars and fats, whatever. So, you know, there is that element of self-experimentation potentially. but also just being aware of, that, just because somebody says this might work doesn't mean, if you feel the benefit that it's definitely whatever wacky therapy somebody
This
or
is it.
whatever.
And this is where the accurate information comes in as well, doesn't it? And being able to discern between somebody who's trying to, sort of basically sell snake oil and somebody who's trying to, give you accurate information, and giving you the information and those tools that you can help make the decision yourself is quite important, isn't it?
Yeah, I think so.
And
Yeah, absolutely.
yeah, it's a huge thing. And with regards to blood groups, just leave that to us for transfusion. We're happy to
Yeah.
handle that. Don't be doing diets on it, please.
Exactly, yeah.
So in terms of your research was, not like in the gynae field, it wasn't in the endometriosis field, but yet you've been able to turn your knowledge and research and your skills towards developing a product to help those support those who live with endometriosis symptoms. Can you tell me a wee bit more about that product development and the research that went into that?
Yeah, so basically, I suppose pre-COVID, I would have done my own research where I myself was in the hospital doing specific trials on specific patient populations and blood pressure on COPD, cystic fibrosis, high blood pressure, sleep apnea, asthma, you name it, lots of different cardiorespiratory disorders. And, we won lots of awards and wrote lots of papers and so on, and all the research is published, and that was brilliant. But I guess it really taught me how to navigate the research field, how to read a paper, how to interpret it, what was significant, what wasn't, what was of value to the patient on the ground as such, as opposed to just saying, well, this might have a small effect on something which is largely irrelevant. So, as I say, my passion for endometriosis was ignited back in 2019 at the conference you kindly invited me to speak at, and then at the movie screening, I really thought. So what I was trying to do was help as many people as possible all over the world. And obviously, me, myself, I couldn't go and see all these people in a clinic because it just, I think there's about 200 million people with endometriosis, which is just amazing, really. And it's only now been scratching the surface of a little bit of, publicity around the fact that it even exists. And that's for healthcare professionals and the public. But that's a different conversation, maybe. So, what I've tried to do is come up with a nutrition product based on all the scientific research that's available to date among people with endometriosis, targeting the underlying pathology, so what actually causes, and we don't know enough about it, but we do know certain aspects, and then obviously the symptoms, and the symptoms, as your listeners well know, can be quite severe, from pain due to pain, infertility, bloating, and so on and so forth. So it's trying to target actually what's happening underneath, and then how that pathology actually manifests. So we've just launched the product this month, October 2023. So it's been on the go for at least 4 years, but really 1 year of intensive work since the movie screening. So we're delighted to eventually launch that product. And the product contains, I just want to make sure I get it right, 17 nutrients. And each of those is specifically chosen by me based on the research in the proven amounts to help with multiple aspects of endometriosis. And those nutrients include things like seaweeds, Irish seaweeds. We have an Indian frankincense extract, which is called Boswellia serrata. We have pineapple extract. We have curcuminoids from turmeric extract. We have ginger extract. We've a really powerful antioxidant called N-acetylcysteine, or NAC. We've another compound called PEA. We've got piperine, which comes from black pepper, silymarin, which comes from milk thistle herb, and then we've got quercetin, which is a type of nutrient called a polyphenol. It's found in things like red onion and green tea, but in really, really small quantities. And then we've also got key vitamins and minerals like folic acid, vitamin B6, vitamin C and D, and zinc. So all of those nutrients in the amounts that we use have been documented to have profound effects on endometriosis pathology and symptoms.
And that's, I think, one of the things as well that you'll find that people with endometriosis are looking for, that we've maybe read headlines, and, N-acetylcysteine was one of them recently, and you read the headline and you think, oh, this is going to be brilliant. And then you think, oh, I'm actually taking vitamin D as well and zinc, and I'm taking maybe vitamins, and I'm taking, you know, and you think, if we could combine this in one. So it's nice to see something like that sort of brought together. But did you find that, and certainly from, you know, my own sort of side of it, I find that there's not a huge amount of research in endometriosis in general. A lot of the research that's out there on endometriosis and nutrition as well, we could really do some, you know, good studies, well-designed studies. Could you see a role for something like that in Ireland, or is something like that just too difficult to carry out? Say if you wanted to carry like a randomized control trial, could we do something like that?
Yeah, I think look, anything's possible, especially when you get people together and working together. So absolutely, it would be possible. It wouldn't be easy, but as I always say, like nothing worthwhile is necessarily easy. So absolutely, I'm always reminded there was a study done. It was done the year I was born, so 1987 again, to show my age here. And it was done in the UK, where a group of patients just got together. Now this was, you know, a long time ago, and there was very little therapeutic interventions for MS. And thankfully now there is some, but back then there wasn't. So they got together and they raised money by themselves, and then funded a research trial on nutrition themselves, amongst themselves. And that was published by really, really excellent researchers in really, really good journals. And it was kind of cutting edge science for the day. But obviously things have progressed since then. So I always just think of that study, that literally, you know, the power of people, the power especially of patients, who are obviously so proactive and so passionate, that it's kind of hard to replicate that. So yeah, absolutely, it could be done.
I'm sure you've seen that in the MS community as well as the endometriosis community as well too, that people are more than willing to help and more than willing to give their time. And I suppose I always think of some of the plant-based people that I follow, and you know, there's always that line, there's no money in broccoli, you know. So we're probably not going to see a randomized control trial on broccoli. But in terms of, you know, combining a product like that, can you sort of tell me how difficult that was to try and get, like, obviously good quality ingredients, you know, local source ingredients where you can, but how do you bring all that together in something that's, you know, bearing in mind, we usually have dodgy bowels, we usually have dodgy tummies, we might be a wee bit hypersensitive to things, you know, and then you've got the awkward people like me who are vegan and gluten-free. How do you do that?
Yeah, well, thankfully we've managed to tick all the boxes. So the product is vegan, it's 100% plant-based, and it is gluten-free as well. And and also suitable for younger adults. I think it's ages 12 and up. So yeah, I mean the process was quite difficult, because as I say, you know, one of the things I saw at my clinic was people were coming saying, well, you know, I'm taking a vitamin D and vitamin C and zinc and 5 or 6 botanicals and whatever, and all of a sudden they're on 10, 15 different preparations, and that's just their supplements, never mind any medications or anything else. And I was just thinking, God, like it sounds really expensive and really painful to have to take 15 tablets or 15 different preparations every day. And a lot of people then were coming and saying, oh, I'd heard that such and such was good, or I'd read this on a blog or something, or saw it on Instagram or TikTok. I was thinking, well, there's absolutely no evidence that that's good, and there's actually some evidence that it's harmful. So I certainly wouldn't be recommended it. And then they were like, oh my God, like throwing it in the bin as we're walking out the door. I was thinking there has to be a better way. And that's kind of the reason why I founded a nutrition company. You'll have to forgive me, I'm in my office here, so all the boxes here are behind me. So the company's called Phytaphix, where phyte means plant, and then fix to fix your health. So plants to fix your health, phyte to fix your health, Phytaphix. So when we were doing our trials to get the product tested, it was really, really cumbersome. We had to try and combine everything which we found was effective in a single product. It meant that we had to combine all of the ingredients in the optimized doses and then try and put that into a capsule. And this was extremely difficult because we had to, if you can imagine, we had to weigh them, we had to blend them together. Certain elements kind of fought, they didn't like each other. Certain elements kind of stuck together, other elements almost like, you know, ran away from each other. So it was really tricky. And then to try and get the amounts that we were looking for, in other words, the effective amounts, was very, very difficult. And then, obviously, as you mentioned, you know, a lot of people with endometriosis and adenomyosis, and And a lot of people in just the modern world have like tummy sensitivities and gut sensitivities and so on. So we didn't want to put in any kind of, as it's called in the industry, nasty. So we didn't put any fillers or additives or chemicals. Or it's literally active ingredients and the capsule, and that's it. So there's nothing else in there. And we even were able to source a capsule made from fermented tapioca. So again, if there is anybody with a dodgy tummy or bowels, this is probably as safe as you're going to get with all natural ingredients.
That's brilliant. Like that is a great achievement, because, you know, I know myself from like over the decades of mixing and matching and combining all sorts. Yeah, it can be hard in your system, and it's usually the fillers. I think that most people just find intolerable as well too.
Yeah.
And in terms of, you know, if I was to take your product now and say, right, you know, can you give me the biggest influence that's in the Endohormone Phix, or what's the one ingredient that you really didn't want to leave out?
Oh, okay. So if we go first question first, so the biggest influence, I mean, for the person themselves taking it, I think pain. If somebody is in pain, regular pain, I think they will notice a reduction in pain, and that we based on our own research and the research which is available, we imagine that will come relatively quickly, maybe within 4 to 8 weeks. But other benefits may take a little bit longer. And you know, the composition has been shown to have things like serum estrogen levels, which is obviously, you know, a major contributing factor to endometriosis. Also CA125 levels, which again I'm sure many of your listeners will be very familiar with, so that we can actually lower both estrogen and CA125 and inflammatory markers and progesterone. Not progesterone. Prostaglandin E2, which is one of the other kind of sensitive markers that's used for endometriosis. Also, just in terms of you know, the actual the period cycle, it does seem to be able to reduce volume and duration of bleeding, which again maybe not will affect everybody, but anybody who does affect, it does seem to have that effect in lowering, as I said, the bleeding duration and volume within 4 to 8 weeks. But we think a little bit longer for the overall benefit. And one thing I should just say for your use, I actually I see one over here on the desk. I'll grab it in a second. The product comes in a pouch of 90 capsules, and we recommend 3 a day to get the full doses. But after maybe like 3 or 6 months or something like that, it's probably possible to go down to 2 a day, and maybe even 1 a day. But we definitely think to start off at least 3 a day. We currently have it only available as capsules, but in the future we are going to explore having it as a powder. We just take 1 spoon of powder every day as opposed to 3 capsules. But for now, capsules are what we're using, and people seem to be you know, reporting really good results, even though, as I say, we've just launched it.
That's good. That's good early feedback as well. And I think too, one of the things, and you know, it's a real bugbear of mine as well, is that when we have research done about us, but that doesn't include us. And you were very good. You included, you know, the endometriosis community in the product development as well too, looking for feedback and looking for input and looking for, you know, just the genuine sort of raw comments back from people, because we are usually quite brutal. And it's great to have that, because I've seen too many things go from research to publication, go from research to product, where they've obviously never spoken to a patient in their lives, because it should never have got to that point. And we're living in the land of, you know, influencer branded products as well too. And not to say that some research didn't go behind that, but there's nothing stopping me from, you know, going on to a particular country's website and ordering a product and putting my name on it and calling it whatever. So again, it's very important again that people do look at not just the science behind what is out there, but also who is behind that, and does that person have the credentials, you know. And I think again to, you know, Conor, like what I'd ask you just to speak as well too, that's one of the things that I'm looking for, you know, not just, you know, have you got the book smarts, but you've also got the ability to speak, but you've also got lived experience. And I think bringing those together does bring that sort of different feel to things. So on to that second part of that question, what's the one part that you wouldn't leave out of the formula? The awkward question.
Wow. God, I don't even know, to be honest. you know, like looking at some products which seem to be popular or maybe targeted towards people with endometriosis, you know, they might contain one element which our product contains, or maybe two at a push, or maybe it's just generic things like the vitamins. But we put in, you know, the kitchen sink. We have everything in there which has been shown to be beneficial. So which one would I leave out? Which one would I not leave out? That's a pretty tricky question, I have to say. So I might have to take a pass on that one. But I suppose one thing, not to cop out, but one thing I was very conscious to do was include some of the key vitamins, like vitamin B9 or folic acid. Because obviously, you know, some people using this may be of childbearing age and may, in fact, you know, be planning or hoping to get pregnant. And it just means that they can say, well, look, that product has everything in there. And we actually use a specific type of folic acid called 5-methyl tetrahydrofolate, which is even more bioavailable than folic acid in standard supplements. It's more expensive for us, but it's way more bioactive. And then a lot of feedback is, you know, a lot of people around the world have low levels of vitamin D, mostly because we're not getting any sunshine or not enough sunshine, including here in Ireland in October. So we included vitamin D in there as well. So it means that most people, you know, especially, you know, younger ladies, are probably going to be taking folic acid and vitamin D. So you don't need to take those because it's already in there. So even just for that benefit alone, you know, it's really, really appropriate. But then we have, as I say, I think it's 14 other ingredients on there, you know, targeting the underlying pathologies and the symptoms as well. So
brilliant. And, you know, again, too, I suppose, like everything, like we have a lot of hyper in vitamin D, a lot of hyper and a lot of vitamins. But again, when you take a lot of this into context and, you know, knowing where we live in Ireland, like, you know, once it's sort of, you know, comes anywhere near October, we're not getting any vitamin D from the sun at all. And even during the summer, a lot of us are covered up, or we've got factor 50 on. So we're nearly avoiding it completely.
Yeah, and just on that, Kathleen, just a little bit of value for your listeners as well. So I always tell my patients about Kerley's rule for vitamin D production from the sun. So this is one you can remember. So you want to look at your shadow on the ground. If your shadow, I'm about 6 foot, so I want to see my shadow to be shorter than my height. So in other words, to be 6 foot or less. And if it's not, forget it. If your shadow is really, really long, no vitamin D. And it's got to do with the angle of the sun penetrating the ozone layer by the time it hits the Earth's surface. So it doesn't matter where in the world you are, what time of year it is, or what time of day it is. Check your shadow. First of all, if you've no shadow, forget it. But if you do have a shadow, just check it, see how long it is. I always say to my patients as well, romantic walks on the beach at 9, 10 p.m. in the evening, that won't cut it. The shadow's too long. So just have a little look on the ground and you'll notice how short your shadow is. And if it's too long, no vitamin D, unfortunately.
That's a great wee tip. And considering we have the most fantastic beaches in the world in Donegal, and I'm sure the rest of the country have lovely places too, but Donegal's lovely. What would be the optimal time if I was to get my vitamin D from the sun? How would I do it?
Yeah, so again, this is a bit of a tricky one because we are taught, you know, that sun is going to cause skin cancer, and it does, but it's excess sun. So I would recommend, if you want to get your best vitamin D slot, especially in somewhere in Ireland, you're looking at between 11 a.m. and 2 p.m. really. Obviously, the further south we go here in Ireland, or the closer to the equator we get, you know, the stronger the sun is, and then the same rule applies. Just check your shadow. But somewhere in Ireland, or let's say North America, Canada, Scandinavia, UK, parts of like South Australia and New Zealand, you know, a good time is 9 to 2. But for example, here in Ireland, from September till about March, no vitamin D. It's just not going to happen. It doesn't matter how sunny it is, if the sun is not strong enough. So 6 months of the year, and what we see when it tests patients is high in summer, low throughout the winter, and then high again and low again. And this is not optimal for the body. But the second thing I would say is, for somebody like me with Caucasian skin, you need about 20 minutes of sun, probably 10 to 15 if you're not used to sun, but about 20 minutes you never ever want to burn. So avoid burning at all costs, but about 20 minutes. And then if you can, I would do 10 minutes in the front, 10 minutes in the back. And then I always say Kerley's Knit rule number 2, if I can, for a bonus point, is I expose more skin for less time as opposed to less skin for more time. So in other words, don't go out for 4 or 5 hours with just your face. Go out for 20 minutes in like a shorts and vest or a swimming suit or something like this, and expose as much skin as you can. I'm not saying the streak or anything like that.
I can't claim Kerley's rule number 2 when I'm arrested, no?
No, I'm not taking the blame. But for example, if you just take my arm, for example, here, if this bit is exposed to the sun and then, I'm wearing clothes and I roll down my sleeve, this bit will stop making vitamin D after about 20 minutes. But the new bit that's exposed here will start making vitamin D from scratch. And same again, if I roll the sleeve down again, this new bit here will start making vitamin D, and so on. So you can see, if you're out with your whole arm and then your whole other side of your arm, so your front and back, 10 minutes, you're not going to damage your skin. Absolutely perfect. And then the last one I'll say is, again, for someone like me with Caucasian skin, about 20,000 units I would make in about 20 minutes. So 20,000 units, to put that into context, a really large piece of salmon, about 800 to 1,000 units. So again, do you want 20 minutes of sun, or do you want 20, 25 large pieces of salmon? I know which way I'd go. And then the last one, I know I've mentioned Caucasian a few times. So anyone who has darker skin, of course you can make vitamin D, of course you can. But it's the melanin that makes the skin darker, which actually protects the skin from sun damage. But it means vitamin D production efficiency is a little bit lower, but you can still make the same amount. And that's fine if you're exposed to lots of sun. So example, I'm saying 20 minutes. That would mean someone who has darker skin might need more like an hour. But it will depend on the person's skin, how dark the skin is, and then of course how strong the sun is as well.
Our bodies are truly amazing, like when it comes to something like that, aren't they?
Absolutely.
They really are. And I think that sort of brings us around to the nutritional support side again, doesn't it? In how best do we support our bodies? How do we make sure that, I suppose, we're giving ourselves the best tools to sort of heal and the best tools to work with the inflammation? Because, certainly in Ireland when I was growing up, your food was considered packing and off you go. Like, don't worry about the nutritional content, it'll be all right. You'll be grand. But we've learned a lot. Like we've done a good bit now around sort of things like that. And I know certainly you'll have seen it as well. We tend to take a graw for certain foods where we will have like kale and it's a superfood and it's whatever. But next week it's goji berries and the week after it's something else. When we sort of know that if we have a good mix of, a good varied diet, certainly a huge mix of plant-based diet as well, or plant-based foods, that's probably, quite a good start. Do you really see that, food as a healing tool and a support for the body, or maybe it is just filling, maybe it is just packing? What do you think?
Well, I think it's both, isn't it? But I think there is really good evidence showing that, food, while food is not medicine, that food really supports the healthfulness of the body. And, that's plain to see that, if you have a really unhealthy diet for a couple of days, you feel sluggish, your energy levels plummet, you don't sleep as well, etc. Maybe your mood plummets a little bit. And the exact opposite, that if you have a really, really good diet, that, you're full of energy, you sleep better, you're energetic, you're able for the day. And, I think so many people just don't even realize that. They don't even realize how good or bad they feel, because that's what they do every day. And it's just, that's their normal. But the evidence backs all of this up, there's really amazing research showing that, food can influence your mood, and it can influence your mood very quickly. And that's, when the average person or someone who maybe, is prone to depression, that food can make a difference. And of course, I always caveat things by saying, look, nutrition and food is amazing, but it's part of a lifestyle, and the lifestyle can be even more powerful when we start including, physical activity, movement, with good sleep habits, not letting ourselves get overly stressed, and staying away from cigarettes, hard drugs and things like this. That, you really start, as I say in my patients, like, you're stacking the odds in your favor. So if somebody has endometriosis or MS or any condition, or just wants to live a long, healthy life, it's like, well, it's a cigarette will maybe stack the odds against you, but 10 portions of fruit and veg will stack the odds for you. And how do you weigh it up? And I don't think anybody expects anybody to live a perfect lifestyle, even we don't even know what that is. But adding the odds in your favor means that you can really say, okay, I'm going to a birthday party at the weekend, and I know I'm going to have cake and maybe a few wines or beers or whatever it is. But you know what? I'm going to have a really healthy lunch before I go on a walk, and make sure the next day I have a really healthy breakfast or whatever. And as long as you enjoy that party, then it's certainly not the end of the world.
And that's it. It's about balance, isn't it? And about not beating yourselves up over things as well, too. Because I know certainly, when I was in the middle of horrendous pain flares, literally a can of Coke was the only thing I could manage because it was going to help get the pain meds in. It was going to give me sugar. It was going to give me caffeine. The other times, yeah, surely I could concentrate on my diet. So it's about giving ourselves that wee bit of, I suppose, grace as well, that we can have a treat as such, or something that's going to give us that wee bit of emotional support as well as a sort of sugar hit.
Yeah, absolutely. Like, I mean, as I say, like, if you're in pain, or look, most people are busy, maybe working, maybe have kids, maybe have other family commitments, etc. And add on top of that, MS or endometriosis or adenomyosis or whatever else it is, like, look, I certainly wouldn't be saying to anybody beat themselves up or, be unforgiving. Live your life, enjoy your life, but do realize that, not to have that kind of Coke every single day or every single meal or whatever. But look, needs must under certain circumstances, of course, absolutely. And certainly I would never encourage anybody to beat themselves up. Absolutely not.
And in terms of again, that very busy lifestyle we're all sort of caught up in now. And, again, if you're living with a chronic illness or and that you've, maybe have bad days and that, in terms of what can we do to prepare for things like that? Because we see a lot of people meal prepping, and we see a lot of people maybe going, oh, on those days I only have maybe like a juice or a smoothie, or I might have just, something very basic. Is there a nutritional difference between something that we literally, maybe pick out of the ground and, cook straight away, or maybe a frozen food? Is it okay to do something like that?
Absolutely, and I would certainly encourage it for sure, because as you say, if there's something in the freezer ready to be defrosted and cooked or whatever, or just thrown in the microwave, it's certainly going to be much more satisfying and healthy as such than nothing, or a big takeaway or whatever else it is, or running out to the supermarket and getting as you say, the Cokes and the chocolates and whatever else it is. So yeah, absolutely. So just on a very basic level, we tend to think of fresh is best and etc. And sometimes it is, but sometimes it's not necessarily. So for example, if we take vegetables as a good example, vegetables are picked, and then if they're sent to the supermarket, that could be a 2-3 week journey by the time they're picked in whatever country they're picked in, shipped all over the world, and then end up at a supermarket, maybe sitting on the supermarket for a week, 2 weeks before you buy it, and then bring it home for a couple of days, and then you cook it. Whereas sometimes, what they'll do is they'll pick it in the farm and let you flash freeze it immediately. So they'll lock in a lot of the goodness, and then what you're buying is that locked in goodness, and that's what you cook and that's what you eat. So I eat a lot of frozen stuff. It's so convenient. It's often cheaper. It's often just as tasty. So absolutely, frozen is great. And a great example, if somebody makes, for example, a curry or a bolognese or something like this, just make a little bit of an extra portion and just freeze 1 or 2 portions for yourself, stick them in the freezer, and then when things aren't going so well, then, if you're just really, really busy, stressed, or, as you say, in pain, you can just defrost that, cook that, and then, at least you're nourishing your body, but you're not putting yourself through, torture trying to cook and shop and so on. So frozen, absolutely brilliant, yeah, for sure.
Brilliant. And that is a good help. And it's, like even a bag of frozen veggies, thrown into any soups or stews or things like that, like it stretches them out as well, which is brilliant.
Really does, yeah.
Yeah, it's great like that, and it's, as you say, being able to just throw that extra portion in is really, really good. Now, as you'll know, over the last number of years online, there is a huge rise in misinformation and misguidance out there. And the endometriosis community is not immune to that, unfortunately. And a lot of that is around the notion that there is some sort of endo diet. And it's something I get asked quite a lot. And I know where the notion stems from. And I know that, when you try and put all these things together, it leads to a very restrictive diet and a very restrictive lifestyle for a lot of people. So I'm sure you've seen that the sort of commentary on that. And, do you think there'll ever be something like the endometriosis diet? Will that ever be a thing? Or are we all too individual for something like that?
Well, I think at the minute, as you mentioned at the very start, we don't have enough research really in endometriosis in general, but including when it comes to foods, nutrition and diet. And we just don't have enough information. in saying that, there is some research which is quite suggestive. And if we even just pare it back and think of like some of the features of endometriosis, like inflammation, estrogen, oxidative stress, like these can definitely be targeted from a nutrition point of view, for sure. So I would imagine that probably the optimal diet for endometriosis will eventually be shown to be high in anti-inflammatory foods and low in pro-inflammatory foods, high in foods which are antioxidant. And as I always say to my patients, if you imagine an apple and you take a bite, after a few minutes it starts to go brown. That's the oxygen damage in the apple. And that's what happens inside us, all the time as we're breathing. So there's two ways to stop it. Number one, don't breathe. And number two, eat an antioxidant-rich diet. And antioxidants come from colourful fruits and vegetables, herbs, spices, beans, nuts, seeds, green tea, things like this. These are really, really high in antioxidants. And some of these foods have also been shown to, be anti-inflammatory as well. So it makes sense that these sort of foods would be really beneficial in the context of endometriosis and adenomyosis and inflammation in general, which inflammation kind of drives a lot of processes in the body, from diabetes to heart disease to cancers and MS. That inflammation is so important. At the minute, there is no solid nutrition evidence, really, but there's some very suggestive evidence that certain things can be important. I know there's a lot of interest in FODMAP, the low FODMAP diet, and also gluten and gluten-free diets and endometriosis. And it really seems to be a crossover with IBS. Sorry, my brain's gone blank. Not inflammatory, irritable bowel syndrome, IBS. But of course, not everybody has IBS that has endometriosis. And gluten, although it may not be exactly a health food, is not necessarily, the worst food either. So I wouldn't necessarily just go straight to the low FODMAP or a gluten-free diet for everybody. But for some people, absolutely, they would be really, really good approaches, especially if there is gastro issues as well.
So would you recommend then speaking maybe to somebody like yourself, like a dietitian, or, somebody who's quite well trained in that sort of side before you would embark on something like that?
Yeah, I mean, if anybody is interested in making major dietary changes, I would suggest speaking to a dietitian. I would recommend speaking to a dietitian, a trained dietitian, who can make sure that not only you're going to cut stuff out, but you're not going to miss anything which is important. So we see it all the time. Maybe somebody cuts out dairy products and their calcium intake becomes very low, which can predispose to bone issues and so on. But in saying that, if somebody wants to cut out dairy and they come and speak to me or somebody like me, we can certainly come up with a calcium-rich diet which is still dairy-free. So it's not a major problem. Similarly, if somebody wanted to go vegan or plant-based or whatever, you can sometimes miss out on nutrients, but it's certainly not it doesn't have to be so. So if anybody is listening and is going to make major dietary changes, I would just recommend speaking with a healthcare professional and specifically a dietitian before doing so, just to get the guidance around making sure they're getting what they need and maybe guidance on what might actually help as well.
And I suppose given the high incidence of celiac disease in this country, and also the high incidence of B12 malabsorption, it's worth checking in with your GP as well to make sure that those sort of conditions have been excluded as being maybe a source of irritation, or maybe a source of why maybe certain parameters like B12 or iron are low. Because when you're bleeding very heavily from something like adenomyosis, it's very easy to fall into iron deficiency anemia, and then when your B12 starts going again, like you end up then like into the macrocytic anemia. So it's, I suppose keeping an eye on things like that, but making sure that we're absorbing it as well is very important. And I think too, where, any of us who would have done home economics back in the day, we would have learned that combining certain foods are important. And I suppose equally with taking something like the Endohormone Phix or even any of the Phytaphix products, I'm sure, like many a person like myself will have knocked something back with a cup of tea and then gone, that probably wasn't a good idea. So we know that certain things interfere. So we know orange juice and iron, right? Vitamin C and iron. We shouldn't take the tea with the iron because it's going to block it. So when if I'm taking the endo hormone fix now, what's the best way to take it? Do I take it just with a wee drop of water with dinner, or do I take it on an empty stomach, or what's the best way for that?
Yeah, so we just recommend taking it with food. So many of the nutrients in there are what we call fat soluble, and it means that they're absorbed with fats, with dietary fats. And if you don't consume fats at the same time, so this doesn't mean you have to have a burger or a pizza or something like this. Any sort of meal will do absolutely fine. But if you don't have it with a meal which contains some fats, like for example, if you just had it with a plain slice of toast with nothing on the toast, we know the absorption would be decreased. But in just an average meal, like let's say porridge in the morning with some seeds, or lunch with let's say a sandwich and a yogurt or whatever, and just like a stew for dinner or something, any of those meals would be absolutely perfect for helping to absorb it. But if somebody does go to the border of buying, a product which does have these fat soluble nutrients like vitamin D, for example, certain ginger components, the curcuminoids we have in there, the Indian frankincense, like they're all fat soluble. And if you don't take it with the fats, then you're not going to get the full benefit. And kind of, not that it defeats the purpose, but it definitely decreases the effectiveness. The other thing I say is, so we recommend 3 capsules a day. And if possible at all, we do recommend spacing those out. So if you can, maybe 2 at breakfast and 1 at dinner, or maybe 1 at breakfast, lunch and dinner, because it just means the nutrients go into your bloodstream each time. Whereas if you take them all at once, you get a big spike, but then they kind of come out of your bloodstream over the course of the day. So if you can, 3 times throughout the day, but obviously that's quite difficult in people's lives. So most people do take 3 at once, and that's absolutely fine. But if you can at all, if you're working from home, or if you can keep it in your handbag or at your desk in work or beside the cooker or something like this, that 3 separate times would be better than 3 at once. But I suppose that's really at the upper end of effectiveness. We're talking small differences, but look, every little bit counts, and some people will be motivated to take 3 a day separately, whereas others might prefer to just do 3 once a day. But definitely more important to make sure you take it with a meal.
Brilliant. And that's a great tip as well too. And it's one that, we often miss sometimes with even medications. We might skim through the packet and think, that'll be fine. And then you miss the bit where it tells you not to eat grapefruit. Or take it with meals. You're like, oh, okay. It shows you how formulations of not just supplements but medications and all that are, they are dependent on certain variables.
Absolutely.
One thing I wanted to sort of touch on, and it's I suppose too that if we look at the irritable bowel side and all the bowel sort of symptoms that come with endometriosis, that people are a little bit scared of going towards maybe a more plant-based diet or including more plants in their diet, and especially like the beans and legumes and stuff. They're sort of thinking, have enough bother there without picking all that off. So is there a way, would you say to somebody, like, would you gradually introduce it, or how would you sort of talk to somebody around that if they're looking to introduce more fibre, again, to help with the hormone clearing process, but also to help with that bowel transit as well?
Yeah, absolutely. So as you mentioned there at the very end, like 5 different types of fibres have been shown to be very beneficial, obviously for bowel function, which we know, clearing the bowels out and so on. And that's kind of where fibre was traditionally thought to be important and nothing else. But we now know what happens is the fibre is actually digested by the bacteria in our gut, the gut microbiome. And then the gut microbiome produce compounds from eating the fibre. And those additional compounds which the bacteria make are really, really beneficial, including for things like the brain connection, as well as inflammation. So short chain fatty acids, we call them. So really, really important. And unfortunately, if someone doesn't eat a lot of fibrous foods, then they're really going to miss out on a lot of benefits, including these short chain fatty acids. If somebody isn't eating a huge amount of plant foods or a huge variety of plant foods, then absolutely, as you mentioned, the best way to go about it is just increasing slowly. And that could mean literally an extra spoon of porridge or, beans or something like this per day, and then maybe building that up and so on to the point where it's not causing any trouble anymore. And it's the same with anything, if we think of some medications, you can't just go in at the highest dose. You start off really small and then you titrate it up. So the exact same, like we're not trying to run a marathon tomorrow, we're trying to do a little bit of exercise tomorrow. And the same for increasing fibrous foods and plant-based foods. Our gut will adjust. We will change the bacterial composition of our gut, which means not only are we more able to digest it, but we're more able to get benefit out of it. So, I would not only say it's a good idea, I would actively encourage it to say if somebody is going to increase both the amount and types of plant foods to do that slowly. You know, not like overnight say, bang, I want to go in with everything and then say, oh, I feel awful, this plant-based thing's terrible. To go in slowly and say, okay, I'm going to go from eating no fruits and veg to maybe 2 or 3 portions with maybe half a portion of legumes per day, and then building that up to the point where, you know, you don't have any issues with any of these foods. The other thing I would just recommend as well is just to make sure you chew foods. So obviously if you have a mouthful of beans and you swallow them, your body has to do an awful lot of work to break that down. Whereas if you chew it, digest it in your mouth for a long time, by the time it actually gets into your tummy, you know, a significant amount of the hard work is done. I always remember a quote from somebody saying, really, like, try and drink your foods, like literally break them down as much as you can in your mouth to the point where they're almost liquid and you just swallow them, as opposed to shoveling in beans and not even swallowing them. That's a no-brainer. That's going to give you gas and bloating and everything else. But you know, I certainly wouldn't recommend people do that.
Yeah, the stomach has no teeth.
Exactly.
And that's it, isn't it? It is. But, you know, that sort of takes us back to being very mindful in what we're doing as well, doesn't it? You know, that sort of mindful eating thing. And I know we've seen mindfulness bandied around so often for everything, but mindful eating, even just thinking, you know, not just what you're eating, but how you're eating it, the environment you're eating. Are you standing at the counter, or are you in the car? Are you dashboard dining? You know, it's nice to try and sit down and have a look what's on the plate and sort of think, okay, this is here just to, you know, fulfill a lot of things. So it could be a social thing that you're sitting with family or friends and you're eating. It could be, you know, it's going to satisfy your hunger. It's also going to, you know, help fight the inflammation. It's going to bring nutrition. You know, there's so many things tied up with food, isn't there? And it's learning to enjoy that again thing, I think, too, if you've been quite unwell, especially with bowel issues or gastric issues, you know, it's learning to enjoy that food.
Yeah,
is nice.
And, you know, what I would say is, you know, I was in France a couple of weeks ago, and it always strikes me when I'm on the continent that people just seem to, it doesn't matter how busy work is or whatever, it's sorry, it's dinner time or it's lunchtime, and they sit down for a 2-3 course meal every day, and, you know, well, maybe not every day, but, you know, a lot of the time, and just relax, and their phone's not ringing, and they're not eating a sandwich at their desk in 5 minutes and getting back to work. I think that's really, really important, to kind of switch off and enjoy the food, the company, the eating occasion, as you say. And obviously, if somebody is, you know, unwell today and tomorrow, you know, we're not recommending that you have a lovely meal with your neighbours or whatever, invite the whole family over. But when you are able, you know, enjoy those experiences, you know, enjoy the meal and the company and so on. And yeah, absolutely. You know, I think the mindfulness thing has been a bit talked overhyped maybe as such, but absolutely just enjoying your food and, you know, taking time and enjoying what's on the plate, you know, I think is much more healthy than just having a plate of broccoli and shoveling it in and getting out the door. So it's not just always about, like, you know, what we're eating, maybe it's about how we're eating it as well.
It is. And I think with the media and certainly social media, everything is hyped to the extreme, isn't it? We can't just have kale. We have to have kale smoothies and kale and absolutely everything. It's the same with mindfulness. And it's, you know, I suppose, again, this always, and I'm always banging on about this, people are sick of listening to me talking about the 1% theory, but it is that. It's those tiny, tiny changes that all add up that make a difference, you know? And that might be something, again, adding in that wee bit of extra porridge, that wee supplement, or, you know, eating slightly differently, or changing the times when you eat your meals as well can sort of help too. But you touched on one of my other favourite topics, and I'm going to grill you on this now for a wee minute. The microbiome. So are we just really here to serve the gut and other microflora that we have? Or is it the other way around?
Wow, that's a big question to start off. I think we're really scratching the surface of the microbiome research, and really the microbiome essentially refers to the bacteria within the gut. But we also have a microvirome, which is the viruses within the gut. And then we have fungi within the gut, and we have lots of different things going on in there. And we're really only scratching the surface. So people tend to think, you know, maybe if they have, I don't know, as you say, kale, maybe if you have kale, then your gut's really happy and your bacteria all running around, without realizing that there's probably thousands of different types of bacteria, and maybe tens of thousands of just different strains and so on. So it's not like taking one food or something. This means the whole entire gut is happy. and taking one bad food means, bad food means the whole entire gut is unhappy. But the gut really does seem to be quite important for a number of things, a number of reasons. But the nice thing is that kind of the things we've been talking about, in terms of lifestyle and nutrition for forever, really seem to hold true. So we mentioned fiber. There are really two ways that we can nourish the microbiome. Or number one, with fiber, which, as we said, the microbiome or the bacteria in our gut actually digest and make the short chain fatty acids. And the foods which are high in fiber, as we said, were like the whole grains, your wholemeal pasta, potatoes with the skin on, fruits, vegetables, beans, nuts, legumes, and seeds. Whereas we're not going to get any in meats and dairy and so on, and eggs or whatever else it is. So if you want to have a diet high in fiber, then they're the foods you need to eat. But the other route then is something called polyphenols, and these are I mentioned these earlier because they're in the hormone fix. But polyphenols also nourish the gut in a similar way. And polyphenols then are found in again your colourful fruits and vegetables, your herbs and spices, your green tea, your dark chocolate, foods like that. And then it just so happens that they're really the foods that have fibre and polyphenols. And there's very few polyphenols in, again, the animal products as such. And say if somebody wants to increase these foods, they may think about talking to a dietitian. And if somebody wants to decrease the animal products for various reasons, again, that's absolutely fine. But just, consider seeking professional advice from a dietitian before doing that. But do we serve the microbiome or vice versa? It's a deep question, but I think really what's coming more consistent is the microbiome is really, really important. But even research is coming out now showing that stress is not so good for the gut, for the microbiome, and we can measure this. And also physical movement, physical activity seems to be really good for the gut as well. So, it's kind of showing a new way that the old things are beneficial for us. It's still the plant foods, it's still the exercise, it's still the stress reduction. But now we're saying, oh, that's really cool. It has this effect on the microbiome. But you know what? It's still really doing the same thing. So, there's major advances for sure. But at the end of the day, what do you and I and everybody else listening to need to do? Try and increase our plant foods, try and be physically active every day, and try and, not be really stressed 24/7.
That's it. And it is as simple as that, though, isn't it? And introducing that variety into your diet as well, too. So, many plants, many sources. And, I think we forget, too, that plants include, seeds and spices and fruits as well, too, because people often separate fruits out from the vegetables. So there's such a wide variety out there for us as well, too. And it keeps the bugs really happy when they see a mix of
absolutely.
things.
So
it really does.
There's some really fascinating research showing that, if you have a choice between, let's say, 4 apples every day or 1 apple and 1 orange, so 2 portions versus 4, but the apple and orange together would be more beneficial than the apples alone. And a really simple way to think about it is just say apples are really high in one nutrient and really low in another, and oranges are really high in one nutrient and really low in another. And obviously, by having an apple and an orange, you're kind of getting the best of the both worlds. But if you're adding in some strawberries and some bananas and some kale and some linseed and some wholemeal pasta and so on, then you're really hitting a lot of different ticks as such. So I think people come out now saying try and have 30 plants per week, which sounds like an awful lot. There's only 4.5 different plants a day, so it's not that difficult. But also I always just think, well, why limit it? Just say, like, eat as many different varieties of plants as you can, and maybe it should be 60. I don't know. I don't think anybody knows, but I don't necessarily agree with setting a limit 30. Aim for 30. Aim for 100 and see how high you can get. But definitely variety is so important. And even just for our taste buds, if we have the same thing every day, we kind of get a little bit bored and so on. So yeah, absolutely, variety. So, and look, literally variety is a spice of life. So use a variety of spices, right? But the same thing goes for physical activity. Like if we just say, well, I'm going to go for an hour's walk every day, that hour walk will all of a sudden feel like 2 hours after a month or 2 months. Whereas if you're going for an hour walk today, a bit of a cycle, a bit of gardening, a bit of swimming, playing with the grandkids in the playground, whatever it is, all of a sudden you're very physically active and you're not exercising, you're just enjoying moving your body. So variety is so important. for so
It
many
is,
reasons.
and you know, we've quite elaborate brains for the shape and size of us, you know, and it keeps the brain stimulated as much as everything else, that difference. And we'll know that if we haven't been for a walk in a particular area in a while, you rediscover things, don't you? And it's
Yeah,
great, you know. And for me, it's like, you know, I was finding lunch breaks, I'm like, oh, I really do not want to go outside. It is cold and it's raining. But I found now that even that 5-10 minute walk has just been brilliant. It's been really, really good. And again, to that sort of mindset of me being, oh, it has to be all or nothing. It has to be an hour flat out killing myself in the gym or nothing. And it was more often nothing. So I think we need to know, I need to take the approach I take to food to also exercise and that as well, that little
yeah.
bits and often are really good. And that variety that you've mentioned as well too is fantastic.
I think earlier on you were talking about that 1% thing, and one thing I would just say to anybody listening is it's just consistency is way underrated, as opposed to just say, okay, I'm going to the gym now, I need to do an hour of high intensity or whatever. Like, you know, you're not going to do that every day, but if you're saying, right, every day I'm going to go and move my body, that's much more beneficial than saying I have to go to the gym and kill myself for an hour. And the same for nutrition. You know, if you're saying, well, look, every day I'm going to make sure I have a really healthy breakfast and I at least have salad with my lunch, no matter what else I have, and, you know, some soup with dinner or something. If you do that all the time, then it doesn't matter so much if you do end up having a pizza or a burger or whatever else somebody might like to have. And similarly, you know, if you have a lazy day but you're moving your body every day, other day, that's much more beneficial than, you know, like none of the blue zones, the people who live to be over 100, they're not all running around doing an hour of high intensity exercise every day and having kale smoothies. They're really enjoying their food with their friends and their family. They're physically active all the time, even till they're 100 and 110, and they're just, you know, they're just consistent. So if I had an idea for people listening, you know, go for consistency as opposed to perfection, because we don't even know what perfection is, even if it was something worth aiming for, we don't even know what it is. So
I love that. Consistent. I think that has to be the best Kerley rule there. Like, you know, I think you need to patent that one.
Yeah, it's going to be
like that.
Consistent, right? Conor system.
Trademark that quick.
Trademark.
You know?
Yeah.
Oh no, but it's so true, isn't it? You know, Conor, it's been absolutely fantastic chatting with you again, and we could be here all night. There's no doubt about it, because I've got loads of things I could be picking your brains on.
Well,
Conor, what I'm
going to have me back. But one thing I'll just say before I go is, you know, from the initial time I spoke at the conference to engaging with the community as much as possible over the last number of years, one thing which has come back as a bit of feedback is, you know, more information around nutrition and diet. And one thing which I haven't started working on yet, but I am trying to start working on it, is kind of an online education platform specifically about nutrition and endometriosis and adenomyosis, and specifically what information is available in terms of what science is available about that, you know, overall nutrition, dietary patterns, individual foods and individual nutrients. And, you know, if anybody is interested in that, just engage and let me know. It's a thumbs up or you're not interested. And, you know, the more people that tell me this is something they're interested in, then the harder I'll work to get it as soon as possible. And I just see hanging over here, before I go, just to show everybody that's watching, this is our famous product here. So Hormone Phix, if it comes out there. And sorry, with the light, Hormone Phix. So Hormone Phix is the name of the product. And hopefully we can put some links out as well.
Perfect. I'll put all the links in the show notes, and certainly we get this shared out in social media as well too. We'll get the links over there. Conor, again, it's been fantastic chatting, and thank you so much for your interest in endometriosis. You certainly did not have to take my phone call that day in 2019, but you took it, ran with it, you know, went up the mountain with it, and have come back down the other side with, you know, insights, research, and again, fantastic support for the community. And that's something, certainly on behalf of the community, I want to thank you for. You know, normally people have a very direct link into endometriosis, and like I say, you came from the outside as such, but discovered that it is always very, very close, you know. So thank you so much for that.
Yeah, and likewise, Kathleen, you know, like ever since we met, you know, I've just been so impressed by your energy and your passion, and, you know, I hopefully bring a little bit of that to my work with endo, but you know, MS and so on as well, and hopefully we're only getting started. So, you know, I'm so glad I took that phone call and went up the hill.
Perfect. Thank you so much. We'll chat to you all later, and thanks for listening to this episode of Dietary. We'll catch you all soon.
Thanks, Kathleen.